Similarly, you must have heard the words like amino acids, fatty acids. So it means in your body you have a lot of acids. Clear? So generally speaking, the human body, it produces 40 to 80 millimoles of hydrogen per day. Clear? So it means we are in a state of production of acids, hydrogen. Clear? Now we have to get rid of this hydrogen. Otherwise our blood will contain hydrogen. Clear? So we have to get rid of this hydrogen, and this is the purpose of this lecture. So first of all, we all know now that our body produces hydrogen. Clear? And the quantity of this hydrogen is, generally we say this is 40 to 80. And this hydrogen, it produces a pH of 7.4 in our blood. Generally, the blood we get from the blood vessels. And we have two types of blood vessels. One is called arteries and the other is called veins. Now, can you think which blood will contain more hydrogen? Venous blood. Why? Because the venous blood is coming from the tissues, and the tissues produce acids. Clear? And carbon dioxide. Clear? So because there is a metabolism happening in the tissues, and these metabolism is generating acids and carbon dioxide and other metabolites, that's why the venous blood contains more acid. Clear? Now please, another important point. When I say hydrogen ion and when I use the word pH, pH is what? pH, this word pH. pH, how do you measure pH? I am just saying pH. pH is power of hydrogen ion. pH is power of hydrogen ion. Actually, it is a calculation, and it is calculated as negative log of hydrogen ion. Negative log. You know what is log? Logarithm is a table. In mathematics it is used. Clear? Actually, it narrow downs the values, log. Suppose if there is an increase of 10 times, in the log table it is an increase of 0.1. Clear? Actually, whenever in terms of log you see an increase or decrease of 0.1, actually it reflects that there is an increase, actual increase of 10 times. Clear? Because in pH, when I say 7.4 and when I say 7.3, normally 7.3 and 7.4 are not very different, normally speaking. Clear? But in terms of log, it's a great change. It's a 10-time change. So the values of pH should be very precisely calculated. Clear? It's a very important point to note. The second important point, I told you this is a negative log. Negative log means there is an inverse relationship between pH value and the hydrogen. It means when the hydrogen concentration will increase, the pH will decrease. So a drop in the pH indicates an increase in the hydrogen. Clear? So a drop in the pH indicates increase in the hydrogen. This is clear? Clear? Sometimes we, in our mind, we confuse. We say acid increase, but the value of pH decrease. Actually, it is same thing because this is a negative log. It's an inverse relationship. Clear? The other fact we need to know that as a result of metabolism in the tissues, we produce carbon dioxide. And this carbon dioxide is also a reflection of acid. Why? Because carbon dioxide in all the time it is reacts with water under the influence of enzyme carbonic anhydrase, and it produces carbonic acid. Clear? Carbonic acid is a weak acid, but all the time we are having. So either we produce direct acids as a result of metabolism, like lactic acid, pyruvic acid, amino acid, fatty acids, phosphoric acid, or we produce carbon dioxide, and carbon dioxide is also a reflection of acid. Clear? Now, as I told you, it means we are all the time in a state of producing acid. So our body will develop acidity or acidosis. Clear? Acidosis, osis means anything happening in the blood. Clear? So when you develop acidity in the blood, this is called acidosis. Similarly, emia, hyperglycemia, clear, means increase in blood. So acidemia means increase acid in the blood. What is the difference between the two terms, acidemia and acidosis? Acidemia means increase. Clear? Acidosis means increase with sign and symptoms. Okay? So if there is an increase in the acid in the blood, this can be termed acidemia, this can be termed acidosis. It depends whether this increase is causing sign symptoms or not. Clear? So we will use the word acidosis in this class. Whenever any change happens in the blood as a result of increased acid production, the body has to neutralize it. Clear? And the compounds that neutralize this change are called buffers. So buffers by definition are those compounds that resist changes in the pH. Remember, buffers maintain the pH. They resist change in the pH. Clear? Buffers are not doing or not creating pH. Buffers are there to maintain the pH. So we have discussed till now that our body produces acids, and this acid can affect the pH of the blood. So in the blood we should have buffers which maintain the pH of the blood. So it means although our body has a tendency to produce acid, but at the same time we have certain buffers in our body that resist changes in the pH. Clear? Now remember, we have three different types of buffers. Buffer by definition, anything that resists change in the pH. One is the chemical buffer system in our body, which is made up of certain chemicals. A combination of chemicals creates a buffer system. The second is the respiratory system. It's a physiological buffer. Whenever any alteration happens in the pH of the blood, respiratory system respond to it and try to normalize it. Because the respiratory system is normalizing the pH, that's why it's a buffer. But it's not a chemical buffer, it's a physiological buffer. And the third important buffer in our body, which is again a physiological buffer, is kidney. Whenever anything happens in the change happens in the pH of the blood, the kidney respond to it. So we have two categories of buffer. One is the chemical buffer and the second is the physiological buffer. Now, what is the one that acts immediately? Chemical buffers. Then comes the physiological, respiration, and then the kidney. Respiration is relatively quick and kidney is relatively slow. Clear? So these are the buffers. Now, what is a chemical buffer? A chemical buffer is a combination of a very good. There are three chemical buffer system as he mentioned. One is bicarbonate, phosphate, and protein buffer system. Clear? Bicarbonate, actually any buffer system has a weak acid and a base, or a weak base and a acid. Clear? And the buffers, how do they work? They convert the strong acid into a weak acid. Whenever any strong acid added to the system, they convert into a weak acid. So the strong acid is supposed to bring a lot of pH changes, but when it is converted into a weak acid, the changes are not so much. Clear? Similarly, when a strong base is added, the acid component of the buffer reacts with the strong base and convert it into a weak base. So the changes are minimized. Clear? So the most important extracellular chemical buffer is bicarbonate buffer system. And what are the component of these bicarbonate buffer system? As I told you, any buffer system is made up of a weak acid and its conjugated base. So the weak acid of this system is carbonic acid and the conjugated base here is bicarbonate. Clear? So as I told you, whenever acid is added to the blood, the bicarbonate of the buffer system react to that hydrogen and convert into a carbonic acid, which is relatively a weak acid. Clear? And second important thing is that this bicarbonate buffer system, it works with respiration. How? That this carbonic acid can be dissociated into water and CO2, and this CO2 can be expelled out by respiration. Clear? So there is, a synchronization between the two systems, the bicarbonate chemical buffer system and the carbon dioxide. Now how carbon dioxide, what is, I will come to it. Before we go, till now, please remember, based on this chemical buffer system, hydrogen ion concentration is related to carbon dioxide in direct proportion. Whenever carbon dioxide increases, the concentration of hydrogen increase. Is it clear? Similarly, the concentration of hydrogen has an inverse relation with the bicarbonate. Whenever bicarbonate will increase, the concentration of hydrogen will decrease. Now this is in terms of concentration of hydrogen, and as I told you earlier, hydrogen and pH has an inverse relationship. Now these two compounds, how they are related to pH? Because we don't measure the hydrogen ion concentration in the blood, we measure the pH of the blood. You got my point? We don't measure the hydrogen ion concentration, we calculate it as pH. So we need to see this, and we have already discussed the hydrogen has an inverse relation with the pH itself. When hydrogen concentration increases, the value of the pH drops. Clear? Similarly, what is the relation between the carbon dioxide and the pH? Inverse relation. Whenever the carbon dioxide will increase, hydrogen will increase and the pH will decrease. Similarly, whenever the bicarbonate will increase, the hydrogen will decrease and the pH will increase. So this has a direct relationship now with the pH, and the carbon dioxide has an inverse. But the thing is same, the concept is same, only due to the values. Clear? So please remember now, whenever we think of pH, now onwards in this class, whenever we think of pH, either it will be due to carbon dioxide or it will be due to bicarbonate. Clear? In this class, in this particular class, now in the next few slides, in the next few minutes, whatever we discuss about pH changes, either it will be due to carbon dioxide or it will be due to bicarbonate. Why carbon dioxide? Because I just told you that your tissues generate carbon dioxide, and carbon dioxide is a reflection of acid. Why bicarbonate? Because I told you that as a result of metabolism you produce acids, and these acids are neutralized by the bicarbonate. Clear? So whenever there is increased production of acids in the tissues, more and more bicarbonate try to neutralize them, and as a result the concentration of bicarbonate drops. Clear? So there are two things from now onwards that will reflect the pH changes. One is carbon dioxide and the other is bicarbonate. Why bicarbonate? Because as a result of metabolism you generate acids, and this acid is neutralized by the bicarbonate, and as a result the concentration of bicarbonate in the blood decreases, which reflects that acidosis is happening in the blood. Now we should know the normal values of the pH and carbon dioxide and bicarbonate. pH normally in the arterial blood it is 7.45, in the venous blood 7.35, and the mean value is 7.4. Similarly, the bicarbonate ranges from 24 to 28. Carbon dioxide is 40 in the arterial blood and 45 in the venous blood, and oxygen concentration in the arterial blood is 70 and in the venous blood it is 60. Now please, whenever you see a table like this which contains these four values, this is called arterial blood gas. This report is called arterial blood gas, and when it is arterial you will not see these values. Clear? So in laboratory, generally if you want to measure your glucose level in the blood, how do you measure it? In the lab. Now you get blood from the veins, but remember this is arterial, so you need to get the blood from the artery. Clear? Arterial blood gas analysis, this is called ABGs. It is called ABG, arterial blood gases. Clear? Is it clear? Now we come to acid base imbalances. I told you when the pH drops, it means acidity in the blood, which is called acidosis or acidemia. When the pH increases, it causes alkalosis. So what is the normal pH? We said mean value 7.4. Clear? So anything which is above more than 7.45, it is alkalosis, and anything which is less than 7.35, it is acidosis. And then you have to normalize it by your buffers of your body, which is called compensation. This buffering is called compensation. Clear? Now after buffering, if you normalize the pH, this is called complete compensation. And after buffering, if you are unable to normalize the pH, this is called partial compensation. You understand these terms now? For buffering we will use the term compensation, and sometimes we say complete compensation and sometimes we say partial compensation. Compensation means buffering. We just mentioned whenever anything happens, any change happens in the pH, the body has buffers which try to normalize, which try to bring back the pH to normal. Clear? This buffering is called compensation. Clear? Now there are two possibilities. Either the pH is brought back to normal value. In this case it is called complete compensation. And if the body is unable to bring the pH to the normal value, this is called partial compensation. Clear? So we just say that when the pH drops, this is called acidosis. Now what can be the cause of this acidosis? Either there is accumulation of acids or due to loss of base. Clear? Either you accumulate the acids in your body, or by some means you lose base from the body, then acidosis can happen. Is it clear? Clear? Means the hydrogens are producing in your body and they are accumulating. Clear? Or your body is unable to control the quantity of the base and it starts losing base. Then you develop acidosis. Clear? Similarly, if the pH increases more than 7.4, it causes alkalosis. What can be the cause? Either loss of acids or accumulation of bases. Is it clear? So now we are moving to the discussion of acidosis and alkalosis, and the fundamental concept we discussed, that acidosis can result either with the accumulation of acids or the losses of bases. Similarly, alkalosis can result from accumulation of bases and loss of acids. Clear? This slide we have already discussed. Now, how the body responds to the changes in the pH? First of all, the chemical buffers try to neutralize it. Then the second line of defense comes, which is respiratory. How the respiratory system try to normalize these changes? If you have increased carbon dioxide concentration, what will happen? Does carbon dioxide itself has an effect on the respiratory center or on the respiratory rate? What is? Increase. Clear? Whenever you have increased carbon dioxide, it stimulates the respiratory rate. I don't know whether it stimulates the respiratory center or it stimulates the chemoreceptors. I don't know this physiology. You better tell me. Both? Okay, both. According to you, both. I am not sure, because my concept is that it is according to these carotid bodies which respond or something like this. This is physiology, I forgot. But whenever you have more carbon dioxide in the blood, the ultimate result will be that you have more respiratory rate. And when you have more respiratory rate, what will happen? You remove more carbon dioxide from your blood. So the pH in the blood will be normalized. Similarly, hydrogen ion itself stimulates the respiratory center. Clear? Whenever hydrogen ion concentration in the blood increases, it stimulates the respiratory center, which stimulates the respiratory rate, and as a result, there is more expiration of carbon dioxide. So there are two effects of acidosis in the respiratory center. One is by the carbon dioxide itself, and second is by the hydrogen itself. Both stimulate the respiratory rate, and as a result, more expulsion of carbon dioxide out of the body and normalization of the. Similarly, when the pH increase, opposite will happen. The rate of respiration will decrease and the lungs will accumulate the carbon dioxide. Clear? This is the respiratory compensation mechanism, respiratory buffering mechanism. Clear? What is the buffering mechanism of the kidneys? Whenever acidosis happens, the kidney will excrete more hydrogen and reabsorb more bicarbonate. And whenever alkalosis happens, the kidney will excrete less hydrogen and excrete more bicarbonate. Clear? So these are the compensatory mechanisms we just discussed very briefly. Now, we come to the respiratory acid-base disorders, acidosis. Remember please, first of all, in the blood, we see a blood report, we see an ABG, and we find there is acidosis. How can we say this is acidosis? By the pH. So first thing we see in the ABG is pH. and we find the pH drops. So we say this is acidosis. Now we need to see what is the cause of this acidosis. Clear? So we will see the value of carbon dioxide and we will see the value of bicarbonate. If we find that the carbon dioxide value is high, more than normal, the normal value is 45, it is more than normal, more than 45, it means this change in the pH is due to carbon dioxide. Clear? So in this case we say this is respiratory acidosis, because the cause of acidosis is increased carbon dioxide concentration in the blood. This is called hypercapnia. So the cause of this drop in the pH is hypercapnia. That's why we call this is respiratory acidosis. But if we see the carbon dioxide is normal and the bicarbonate is dropped, it means this acidosis is due to bicarbonate drop. Clear? Loss of bicarbonate. So this is called metabolic acidosis. Now remember, we are introducing two new terms in the discussion. One is respiratory acidosis and the second is metabolic acidosis. But before this we have to see whether this is acidosis or not. So in the ABGs, first we see the value of the pH. If the pH value you find low, this will say acidosis. Now we need to see what is the cause of this low value. Clear? If you find more carbon dioxide as the cause, respiratory acidosis. If you find less bicarbonate, this is called metabolic acidosis. Similar is the case with alkalosis. Can anyone guess what is alkalosis? How do you proceed? First, what will we see? The pH. The pH will be increased. So first we need to establish alkalosis. Then what will we see? Whether this is due to bicarbonate or due to carbon dioxide. Clear? We need to see which one is causing this alkalosis. Clear? So either if we find increased bicarbonate, then metabolic alkalosis, and if you find bicarbonate normal and carbon dioxide decrease, then this is respiratory alkalosis. Very good. So now we have four types of disorders: respiratory acidosis, metabolic acidosis, respiratory alkalosis and metabolic alkalosis. What conditions can cause respiratory acidosis? Respiratory acidosis means hypercapnia. Now what can be the causes of hypercapnia in your body? Hypoxia causes hypercapnia? No. Suppose if I am a Majnoon, not Majnoon by my brain is not working, my brain is sluggish, slow. Okay, I have taken some drugs which stops the brain activity. Depression, respiratory center depression. Some drugs I have taken which depress the respiratory center. So what happens? I am unable to breathe normally. So my blood will accumulate carbon dioxide. This will result in the hypercapnia and then respiratory acidosis. Now remember, please, do you think this condition can be corrected by the respiratory system?
No.
Why? Because it is caused by the respiration. So remember, I told you earlier, acidosis can be corrected by chemical buffers, by respiration and by kidney. But if acidosis is caused by the respiratory system itself, respiratory system cannot correct it. So we need to be it need to be corrected by the chemical buffers and it need to be corrected by the kidneys. Respiratory system, because the problem is in the respiratory system. Clear? So respiratory acidosis or respiratory alkalosis are not compensated by the respiratory system itself. Is it clear? Now, anything that damages the respiratory center, or you have depression of respiratory center, this called alkalosis. Similarly, when I came with Dr. Wajid in one of the lecture, we discussed diffusion of gases across the cell membrane and something like this. If anything is happening in this diffusion and the respiratory gas exchange is not normal, you develop accumulation of carbon dioxide. Clear? What else? If the lungs are not fully developed. Clear? If there is pneumonia across. So many causes of respiratory acidosis are there. And all are diseases of the lungs, respiratory system. Clear? In which either you are unable to expel, to breathe normally, or there is problem in the diffusion of the gases, or there is accumulation of the fluid, or anything that is happening. Clear? So in all these cases, there will be decreased ability of the lungs to breathe normally. As a result, carbon dioxide will accumulate in the blood and the pH will drop, and this is called respiratory acidosis. So these are the few causes: depression of the respiratory system, paralysis of the respiratory muscles, emphysema, adult respiratory distress syndrome, pneumothorax, pulmonary edema. All these causes, you say there is problem in the excretion of carbon dioxide. Now tell me please, at this point, do you think respiratory acidosis is a disease itself?
No.
It's not a disease itself. So what is this? It's a complication. It's a consequence of some diseases. Clear? It's not a primary disorder. It happens as a result of some disease. It's a condition. It's a response to a disease. It's a complication to a disease. Clear? It's a sequence to a disease. So if this is a sequence to a disease, will it have some sign and symptoms of its own? Of course, yes. Clear? Complications can have their own sign symptoms. So what sign symptoms you develop generally as a result of? As a result of these respiratory acidosis, you develop breathlessness, you develop restlessness, lethargy, disorientation, tremors, skin disorders, worms, flush. So these are the sign symptoms that are presented on the slides that you develop as a result of respiratory acidosis. How will you diagnose respiratory acidosis? What will be the blood picture? pH will be decrease. Clear? And carbon dioxide will be increase. And bicarbonate? Normal. You find it is written normal or high. Why it is written high? As a result of compensation, because now you have more carbon dioxide in your blood. To neutralize this carbon dioxide, the kidney will try to conserve the bicarbonate. The kidney will not excrete the bicarbonate as normal. They will try to get more and more bicarbonate reabsorbed. Clear? And as a result of this, the bicarbonate in the blood will increase. And this increase in the bicarbonate will try to normalize the pH. So if you find the pH normal, this is full compensation. And if you find the pH is still not normal, this is partial compensation. Clear? So this high will reflect compensation. Clear? Is it clear? This high will reflect compensation. So on the basis of this value, you will say the condition is non-compensated or compensated. If you find this value normal, this is non-compensated or compensated? Non-compensated. And if you find this value high, this is compensated. Clear? Compensating. You cannot say compensated, because compensated, the pH should be to normal. So it's compensating, like it is trying to normalize it. Is it clear? So this is a very good diagram. If you just see here, it explains that normally we are in a state of equilibrium. The acids and the alkalis in the buffers are normal. But if there is some problem in the lungs and the lungs are unable to expel the carbon dioxide, this carbon dioxide will increase in the blood, and as a result the acid in the blood will increase, acidosis. Clear? So you find the pH will decrease, the carbon dioxide will increase, and the bicarbonate will decrease, because normally we are in a state of compensation. Now you have more acid than bicarbonate. Then the body try to compensate it, and the kidney will reabsorb more and more and more bicarbonate. So they want to bring the balance to the normal. So this is a state where the body is compensating, buffering. Clear? And then if the body are unable to buffer, then you need to give the drugs to bring the pH back to normal. Clear? So these are the things that you see in a typical acidosis or alkalosis condition. And we have already discussed that acidosis and alkalosis are not disease by itself. Clear? They are the sequence or the result of some other disease. So what is the ultimate treatment for respiratory acidosis? You have to give bicarbonate. So Ringer's lactate is a solution which contains bicarbonate. You give this solution. Similarly, this is the very important thing. You have to treat the cause. If pneumonia is the cause, if emphysema is the cause, as long as emphysema will be there, you will develop respiratory acidosis. So you need to treat the underlying cause and you need to treat the symptoms. So remember, we have two plans for the treatment. First is you relieve the symptoms, symptomatic treatment. If this is breathlessness and all this due to pH disturbance, try to normalize the pH. But once the pH therapy is initiated, try to treat the disease, the cause that is causing acidosis or alkalosis. Now, what is metabolic acidosis? Metabolic acidosis is something in which you have decreased bicarbonate as the primary change. Metabolic acidosis means when you have more acids production in your body. Clear? For example, I say, have you heard the word diabetes? Have you heard the word ketoacidosis? Okay, ketoacidosis is a condition that happens in diabetes as a complication of diabetes, and you produce a lot of keto acids in your body. Have you heard the word lactic acidosis? This happens when you do a lot of exercise under anaerobic conditions. Clear? So these are lactic acidosis, ketoacidosis, where you are producing more metabolic acids. Clear? So here carbon dioxide is normal, but what is abnormal? Acid. Increased production of acid. Similarly, for example, if I develop vomiting, and the vomiting is from the stomach, so all the HCl that is produced by the stomach will be expelled out. So your body will lose the acid. Clear? So all this condition will result in acidosis, and this acidosis is called metabolic acidosis. Clear? So either sorry, I just gave you a wrong example. So there is a one word which is called renal tubular acidosis. What is this? Renal tubular. Have we done kidney? Okay. We will discuss it when we discuss in the module of the kidney renal tubular acidosis. Because I told you one thing, please, just for the sake of the discussion, I told you whenever you have acidosis in your blood, the kidney excretes hydrogen and reabsorbs bicarbonate. But in this condition, actually the kidney are causing the acidosis. Renal tubular acidosis means acidosis is by the kidney. The kidney has some disease and it is unable to excrete the hydrogen or unable to reabsorb the bicarbonate. Renal tubular acidosis is that one. Yes. Respiration. Yes, why not? Now all these, if you have any of these, diarrhea, when you lose bicarbonate, you have keto acids or ingestion of acids, if you have any of such condition and as a result the bicarbonate component of the body decreases, the compensation can be chemical, the compensation can be respiratory, the compensation can be kidney. But in renal tubular acidosis, the kidneys are unable to compensate because the problem is due to kidneys. So what will be the ABGs in the metabolic acidosis? pH will be low, carbon dioxide is normal, and bicarbonate is decreased. Now here it is written normal or low. Why low? Compensation, because as a result of this acidosis, I told you acidosis stimulates the respiratory center, so rate of respiration will increase and you remove more carbon dioxide from your blood and you develop hypocapnia. Hypocapnia? Okay. As a result of compensation. Clear? Now, please remember, there is one important, very important thing which is with the acidosis. Whenever you develop acidosis, it affects the potassium ion concentration in your blood, because the hydrogen and the potassium, they are in a state of exchange. Whenever hydrogen concentration in the blood increases, this excess hydrogen try to enter in the cell, and when the hydrogen enters in the cell, at the same time it brings a potassium out of the cell. You know potassium is an intracellular ion and it is present more in the cells. So whenever you have increased hydrogen in the blood, this hydrogen try to enter in the cells and as a result it brings the potassium out of the cell. So you develop increased concentration of potassium in the blood, which is called hyperkalemia, and this potassium affects the heart. Have you done cardiovascular?
Yes.
So you have an idea of hyperkalemia and cardiac arrest. Clear? So acidosis, whenever you have acidosis, you have a chances of developing hyperkalemia. Please, this is a very important point. Clear? Similarly, whenever you have acidosis, the body will try to excrete more hydrogen and will try to reabsorb more bicarbonate. What are the clinical effects of acidosis? Always you have hyperventilation, because this acidosis is not due to problem in the respiratory system. Respiratory system is functioning well, so you will develop hyperventilation, then you can develop hyperkalemia, and then lethargy, headache. Now, I told you that there are three important buffer lines. One is the chemical buffers in the blood. This chemical buffer try to normalize the pH, but it is not a very powerful buffer. This is a very good buffer because it acts immediately, but it cannot affect, the intensity is not very severe. So it cannot normalize big changes, huge changes. Then comes the respiratory system, which respond to the changes in the pH, hyperventilation and hypoventilation. This takes a few minutes, but the response is very good, and it can normalize, it can normalize the caliber of this buffer system to normalize, to change in the pH is very good, quite good. But still it is unable to correct it fully. Clear? Although the system is very good, it is relatively immediate. It's not very urgently active, but it is active after a certain very small period of time. But it cannot normalize it completely. It can affect it, you can say 50 to 70%, 75% effectiveness. The ultimate normalization is by the kidneys. But the kidney response does not start immediately. It takes time, but it's the ultimate correction. And if the kidneys are unable to correct, then the doctors are there. They have to correct it. Clear? So this is the normal physiological response. But the important thing is that this respiratory system is relatively immediate in action. Clear? And its effectiveness is 50 to 75%. Now we come to hypoxia. We will come to it. We are coming to it. Now respiratory alkalosis. Respiratory alkalosis is a condition in which you are expelling more carbon dioxide, clear, than normal. Normally you don't expel carbon dioxide, but in this particular condition the cause is that the respiratory system is so efficient that it is expelling more than normal carbon dioxide. Clear? So if the loss of carbon dioxide from the blood is due to respiratory system, this is called respiratory alkalosis. What can be the causes? So please remember, first of all, we know that in this condition the carbon dioxide level will be decreased, and it's a rare condition. Clear? And the primary cause of this condition is hyperventilation, because we are having a respiratory rate which is more than normal. So what are the conditions that results in hypoxia? Which results in hyperventilation? Exercise. Very good. If you perform strenuous exercise, not normal exercise. For me, this is exercise. If I jump like this, this is exercise. Clear? But those who play football or those who play other marathon racing, or I don't know what are the sports, but there are many sports which you perform extraneous exercise. So as a result of these sports you develop hyperventilation. Similarly, if two of you decides to climb this Hada mountain, I know there is a way by which you can climb this mountain. Clear? And you say, okay, let's see who reach to the top quickly. Then the two person will race, and because they are climbing a mountain, and as you climb on the mountain you develop hypoxia, and generally you acclimatize your body if you are going gradually, but if you are going quickly, this can result in severe hyperventilation. Clear? So these are the conditions in which you can develop hyperventilation. Hypoxia, you want to bring hypoxia. Clear? So hypoxia can be a cause, whether it is at high altitude or due to blood, whatever the cause is. Similarly, sometimes the patients are on a ventilator in the hospitals, and the doctor say, oh, this person, please increase the respiratory rate, because that rate is under the control of the doctor, and the doctor increase the respiratory rate. So sometimes the respiratory rate is so much increased that it causes hypocapnia. Clear? It causes hyperventilation. So all these results in hypocapnia or metabolic alkalosis. Is it clear? What will be the ABG picture? Can you tell me please now? pH will be increase. Carbon dioxide will be decreased. Bicarbonate will be normal or increase or decrease? Decrease. Because already we are in a state of alkalosis. So the body will try to get rid of excess bases. Clear? So this will be a condition of alkalosis. And what will be the compensation? How? They secrete more bicarbonate. Clear? So there will be excess, and these are the symptoms of the respiratory alkalosis. Please remember, one very important system is tetany. How alkalosis cause tetany? Can you think? Have you discussed musculoskeletal? Yes, in the second year you have done musculoskeletal. Yes, I remember now.
Maybe it decreases concentration of calcium.
Alkalosis, yes, definitely. When you say tetany means hypocalcemia with symptoms. Clear? Hypocalcemia means tetany. So how alkalosis causes tetany? Please. Decrease heart rate. I am saying why alkalosis results in hypocalcemia. I told you in acidosis there is hyperkalemia, and I told you the mechanism. Hydrogen goes inside the cell and potassium comes out of the cell, and alkalosis results in hypocalcemia. Why? No.
Increase exchange between ions.
Which ions?
Calcium and
Because we have done this in the musculoskeletal system. No problem. No problem. This is your task. This is your task. Because we have discussed this in second year. Go back to your musculoskeletal system and see how alkalosis cause tetany, hypocalcemia. Clear? And inshallah I will try to give an MCQ about it in the exam. This is a good point. No sodium. This is very simple mechanism, and I am sure we have discussed this. I am sure we have discussed it. So what is the treatment of respiratory alkalosis? Again, two things, treatment of symptoms and treatment of the underlying disease. Now we have left with the last one, which is metabolic alkalosis. In metabolic alkalosis, the problem is increase of the bicarbonate, and these are the causes: excessive vomiting, which I said in the acidosis by mistake. Clear? Similarly, sometimes you use a lot of alkaline drugs, or sometimes you use diuretic drugs, which results in the loss of bicarbonate in the urine. Similarly, sometimes you take heavy antacids. All these conditions causes metabolic alkalosis. What will be the ABGs? pH will be increased, bicarbonate will be increased, and carbon dioxide will be normal or high. Clear? So these are the some symptoms of metabolic alkalosis. I am not discussing it, these signs and symptoms, because probably the medicine people will discuss with you. Now what is the normal range? What is the safe range of pH? I told you 7.45 is the normal range, and up to 8 the body can control it, can regulate it, but if it is more than 8, death can happen. Similarly, the pH normal is 7.4, and when it drops up to 6.8, the body is able to do, but below 6.8, death can happen. Clear? So the safe range or the normal range compatible with life is from 6.8 to 8. Clear? If it is less than 6.8 or more than 8, death can occur. How will you diagnose the acid-base balance? Can you tell me, please? First of all, you will see the ABG. Very good. And what is the first thing that you see in the ABG? pH. From the pH, you will decide what? Whether this is normal, acidosis and alkalosis. Then what is the next step? Please remember. whether it is acidosis or alkalosis. First you have to see which of the two components, carbon dioxide and bicarbonate, is going with this. Clear? If there is a drop in the pH, this drop in the pH is due to increase of the carbon dioxide, or this is due to decrease of the bicarbonate. You have to establish the cause of pH change. Clear? And then you can say this is respiratory acidosis or metabolic acidosis. Clear? So first you have to see. So in the ABGs, first you will establish acidosis or alkalosis, and then you will establish the cause of this, either respiratory or metabolic. Then what is the third thing you will see? The other value. Suppose if this is respiratory acidosis, then you will see the bicarbonate value, whether it is normal or increase. This will indicate what? Compensation. Clear? So this will indicate compensation. In pH, can anyone revise? Can anyone revise very quickly, please? What will we see in the pH first? Normal. Acidosis or alkalosis. Suppose this is acidosis, then you will see the carbon dioxide and the bicarbonate level both, and we will see which is actually causing this acidosis. Suppose you find more carbon dioxide, then this is respiratory acidosis. Then what is the next step? We will see the value of the bicarbonate, whether this is normal or high, increased. Normal indicates what? Non-compensated respiratory acidosis, and high indicates what? Compensating respiratory acidosis. Is it clear? So please, these are the 3 steps, and probably this table will help you. Yes, this table will help you. We go like this. First we see the pH. If it is less than this is called respiratory acidosis. Then we see the value of the two. If this is respiratory, you find the carbon dioxide more than 45. Then you see the value of bicarbonate to see whether it is compensated or not. Now there is one more thing, and I will discuss it very quickly because this is relatively unimportant. Whenever you have respiratory acidosis, you have to establish whether this is acute or a chronic. Clear? Is this happening suddenly or it's a chronic process? And in case of metabolic acidosis, you need to see this acidosis is related to anion gap or this is non-anion gap acidosis. Anion gap and non-anion gap acidosis. I introduced our term anion gap. Clear? In cases of metabolic acidosis, you have to see whether this acidosis is non-anion gap acidosis or anion gap acidosis. What is anion gap acidosis and what is non-anion gap acidosis? In your blood, you have anions and cations. Anions are negatively charged ions. Cations are positively charged cations. Clear? So the majority of the blood contains sodium. Clear? So you measure the sodium, and the anions that are in your blood are chloride and bicarbonate. Chloride and bicarbonate. So actually what you do, you measure the concentration of sodium and potassium, and you measure the concentration of chloride and bicarbonate. You add the two anion concentration and you add the two cation concentration. The difference is called anion gap, and normally it is from 14 to 18. In certain metabolic acidosis conditions, the anion gap remains the same. Clear? While in other metabolic acidosis, the anion gap becomes increased. So metabolic acidosis are categorized under two headings. Some metabolic acidosis in which the anion gap remains normal, and there are certain metabolic acidosis disorders in which the anion gap become increased. So this anion gap is just to categorize the causes of the metabolic, and we will discuss this anion gap in detail in the next year in the module of the kidney. Not next year, next semester. So that's why I am just introducing it here, that metabolic acidosis you always see whether it is a non-anion gap or an anion gap disorder. Clear? Because the metabolic acid disorder as a metabolic acidosis, it can be either normal anion gap disorder or it can be an increased anion gap disorder. And these, if you want to remember the causes of respiratory acidosis or alkalosis, these are the mnemonics which will help you. You know what is mnemonic? What is mnemonic? It's a order of the letters. Very good. Generally, which letter is considered? The first letter. Finished?